I grew up in Singapore, and coming out of high school, I knew that I wanted to go into medicine. At Washington University, I studied neurobiopsychology and then ended up at the medical school and did my medical degree at WashU. And subsequent to that, was fortunate again to be admitted into the general surgery residency program at Barnes-Jewish Hospital, where I spent the subsequent 5 years. To the public eye, medicine is, and people in medicine are placed on a pedestal. But that pedestal almost isolates them from the real world, and they function by their own set of rules, and it's very childish. They feel insulated from the rules that govern any other social interaction. So it suddenly becomes okay to haze and bully. And I think it's starting to get a little flatter. I hope it is. But it's been this very hierarchical structure for so long that when you're on top, you have the power, and when you have the power to bully in high-stress situations, people revert to that very two-year-old type behavior and get away with it. And that's what we've allowed, is for people to get away with it. And so the behavior perpetuates and perpetuates. There was a pediatric surgeon here in town who used to be the most hated person in the department to work with, because he would send people to the corner in the operating room. These are grown adults, and this is how it would go. You'd be operating across the table, and if you did something he didn't like and there was no telling what it was, he would say stop, and if you didn't stop, he would say it louder and louder until you stopped, or he would wrap your hand with an instrument. And then once you stopped, he would say, put your instruments down, step away from the table, go to the corner. When people abuse the power that they have higher up in the chain and take it out against those below them, that's when it presents an issue. From a healthcare perspective, if you've got a team that doesn't function well and where people don't get along, you open up patients to the result of poor communication. So in studies of medical errors, the vast majority of errors, and this is errors that hit patients, not just errors amongst the medical staff, it's errors that impact patients, potentially killing patients. The vast majority of those errors occur because of poor communication. In the old days, surgeons really were the captain of the ship. Whatever they said went. In those days, medicine was fairly simple, and the surgeon could just dictate what was going on with anesthesia, with nursing, with everyone in the room. Now medicine's gotten so complicated, we've really divided up the responsibilities amongst very high-functioning people, because we have gotten so far and so advanced in medicine. Everyone has to play their own role, or you'll never get the job done right. The problem is that if you still have the surgeon now functioning as the captain of the ship and dictating to everybody below him or her, that's essentially a disregard that they have a role that is their own to play and that they are an important part of the team. I'm the medical director of surgical services at Baylor Scott & White Health, which is the largest not-for-profit health system in Texas. My overall goal is to make surgery as pleasant as possible for our patients, for our surgeons, and for our nurses and our staff. It goes back to the tenet of create a good environment so that even when you're doing the most aggressive, invasive thing to patients, which is surgery, that you give them the best possible experience that they can. And so what I've done in my time there, and what I keep trying to further, is at all levels, we're trying to push leadership to those who are at the front line. And playing in that sandbox is a whole new ballgame. It allows me to really think about what impact decisions at the health system level can make. It also allows me to very quickly come back to, what is this all about? It's still about patients at the end of the day. And keeping that in mind, knowing that the rest of the decisions that are being made at the administrative level have to positively impact all the way down at the end of the chain, the one-on-one interactions. I'm Liren Chen, and I'm a hate breaker.